update, and of course, hopefully you get your bookings in time. But far from that, let's focus on the 16 days of activism. And this is a global day that is commemorated or marked every year between the 25th of November and the 10th of December. The 10th of December is Human Rights Day. And this is to ensure that we are raising awareness and eliminating violence against women, and of course propping up their well-being to ensure that they have bright futures. And there are many ways to do this, including ensuring they get the right education and all kinds of empowerment, and of course get a leg up in terms of how they start off their lives, annexing all the issues of gender-based violence and the likes. Joining me is an expert in this particular area, that is Dr. Nora Akongo Obudo. I hope I haven't butchered your name.
Not at all.
Yeah, to just shed light on this, why is it important to dedicate every year 16 whole days just to focus on gender-based violence and matters that concern women and girls?
Okay, and as you've rightly said, it's a focus because there's a lot of work being done right through the year. But this is just a day that we focus on some of the objectives that we are looking at in terms of violence against women and the things that we need to address. And this includes domestic violence, it includes femicide, it includes intimate partner violence. We're even looking at refugees, even violence in sports. So these are all the areas that we are taking to give the focus that this requires, so that we can advocate and rally among organizations, state and non-state actors towards this, because it's a human right issue, so to speak. So we must really look at this keenly, because it continues to be pervasive. We do feel that we have not made so much ground, and the pandemic as well
hasn't done us any favors.
Yes.
Let's talk about that. The pandemic, actually, it was termed the shadow pandemic. All these atrocities that were happening against women underneath the behind the curtains of the COVID-19 pandemic. Speak to us about how that was retrogressive when it comes to the steps that organizations such as the one that you're affiliated with had already made in fighting for the rights of women.
Well, the pandemic, it was essentially a shutdown, and it was a shutdown to access to services. It was a shutdown to access to even help, even the socioeconomic aspects that was repressed consequently. And women were struggling because of this, because in terms of even family planning services, even pregnancy postpartum these were services that were put on the back burner, but you cannot postpone delivery, you cannot postpone your antenatal care, you cannot postpone your family planning. So those were issues that
that has a ripple effect even to maternal, infant mortality rates.
Absolutely.
Okay.
So that is why the focus comes to women and children in this state. So even with the socioeconomic issues, of course, women are in the service delivery area. So that they were the ones losing their jobs. They were the ones now decreased in labor participation. What does that mean? Then you do not have that purchasing power that you initially had because you had a secure job. That creates more tension in the home. And the women, in terms of the shutdown, then they were exposed to more violence.
Yes. Because you're basically trapped in your violent
you're trapped in that home already. Initially, you had probably a space to go to your work area and come back. So there was an exit of sorts. And even the services that were there to prevent, and even if it occurs, then a woman would be able to go and report and be supported, were not available at that time. And they were not considered.
Yeah, I do understand donor funding actually also got shifted to COVID as opposed to some of these issues.
Exactly.
Yeah, so you've talked about prevalence earlier on. So given that reality that happened almost 2 years ago, now what is the prevalence now? Did we have to start from scratch? What does it look like in terms of how these issues are in our society, even on a continental scale? Well,
we have a lot of work to do. The data still remains. Women are they're still facing a lot of violence. There's stigma even with the reporting of this violence. But I also want to just emphasize that even as we look at gender violence, we do not want to discount that men are not facing this form of violence.
It's not just a woman issue.
They are just faced with a lot more stigma, and they're not reporting the same. So as we look at the data, we will say that 1 in 5 men have faced sexual violence before the age of 18. When you look at women, it will be 1 to 3. When we look at the Kenyan statistics, we will find that even those who have reported as survivors, only 5% are boys and 3% are men. But when you look at the women, it's 56% of the women, and we look at 36% of the girls reporting. So these are we still have work to do, truly, and we're still going to have to recover from the pandemic, as it were, and also the conflicts that are facing the world currently. Yeah.
Wow, that's very, very interesting, because some think of COVID as something that's gone by, but it actually has had ripple effects all the way till now. And speak to us about how issues such as education, empowering women financially and in other ways actually help us move away from some of these retrogressive practices and gender-based violence.
Yeah, and we must... On that, we must recognize that violence is coming through from the gender norms that we have, gender discrimination and gender injustice. And these are things that education will address. If we have these discussions around gender, what is gender? What is respect? How do you respect the other gender? Whether it's a transgender, whether it's a woman, man,
intersex person.
Yeah, the intersex, we must recognize these people. We must respect. And from there, when we have that level of education and no one respect these people, then our relationships then will be determined in that way of respect.
Yes.
So apart from education, of course, when you're empowered, whether financially and through knowledge, then knowledge essentially is power.
Basically,
you will know how to identify even when there's a safety risk. You'll be able to know where to seek services, because now you have knowledge and you're aware that this is harassment, because sometimes we don't even realize as women that you're being abused.
Yes.
Yeah, you know, like whether it's verbal abuse or physical, yeah, there can be that, but even verbal abuse
even
is
financial
part of,
abuse.
Yeah, financial abuse, so that exists. So how do, if only we know, then can you say that this is happening, and then you can take action. And therefore that comes to that even the services then have to meet that need. After creating awareness, there has to be that service that meets that need.
Absolutely. Yeah. And even with seeking justice, speak to us about that, because even the harassment might have happened to this person, but then when they are seeking for justice, they face, they're re-traumatized and harassed. If a woman is educated, how would she be able to handle this type of thing?
If she's educated, therefore, she will be able to know what her rights are and what exists within their country or area or environment, so to speak. And this is the work we do have in terms of, you know, looking at the legislation. We need to look at policies that are able to support survivors and reparation of the women and girls. We need to look at legislation that supports the investigation and prosecution, because we don't see this running through to the end, and that creates you know, you feel, you know, why should I go forth with this case? Why should I push? But we need to make it easy for them. We need to stop the issues where when you have faced violence or you're a victim of violence, then you have to pay for your P3 form, as we see in some places. I mean, it's already a burden that you're having, that you have been abused or violated. Then you have to go and pay the P3 form. Then you have to go and retell your story to each and everyone, and your case doesn't go through. And sometimes it runs up to 4 years before it's resolved. So we have a lot of work to do in terms of the legislative processes.
Making it easier to access justice for women. And as you mentioned earlier on, also men face it, but this 16 days is focusing on women. Now, you are affiliated with Women Lift Health. Tell us about this organization. What do you do, and how does it feed into the need to ensure women get justice?
Okay, so for us in Women Lift Health, we were established back in 2019, and we have been like pushing globally, and in fact we call it cross-regionally, because we are in North America, we are in Africa, we are in South Asia. Our focus is really on women's leadership in the health sector, so that is a very specific niche. And what we're focusing on in the health sector, we're saying that 70% of the health workforce are women, and only 20% are getting into senior leadership, and 5% in the C-suite level. Why is this 25% important? This 25% that we are missing on is where decisions are being made as pertains healthcare, and where the policies are. And we are the consumers of health. We are the ones in the household ensuring that our families are healthy. If we are not at the decision table, bringing in our lived experience, for instance, bringing in our added value in leadership, where we are generally collaborative, we are generally inclusive, and we're always looking for social impact. So looking at education and welfare. of communities. If we miss on that, then what are we doing in terms of ensuring that there's improved health?
Absolutely.
Yeah,
this reminds me of that conversation on sanitary towels, whereby journalist and radio personality Caroline Mutoko had to got asked by Njokinu, the Justice Njokinu, what is the problem? And then she went and found out that sanitary towels are being taxed as luxury goods. Without her being within that particular circle and that level of education, then we wouldn't know that was the actual problem in the country. So speak to us about other avenues and other ways, literal ways, that women in this who have risen, who could rise to these particular areas that influence how health policy and the likes can actually effect change in our community.
Yes, they can effect change, and this is part of our interventions as a program, because we look at the woman as an individual. We look at the woman as she exists within the environment, which is the workplace and home, and also within the community. So you'll find that with Women Lift Health, we do have a leadership journey where we provide women with tools and a safe space to engage on matters leadership. And we look at and we accelerate their ascension into these positions, because as I've said, it's in the senior leadership and C-suite that the decisions are made. And if they're there, then we can be able to address matters across, even including gender-based violence. So if they're there on the table, they can speak to it. We also look at the work environment, and this is part of the focus as well for the 16 days of activism, because we're looking at harassment in the workplace which women are facing. And you know, it was just interesting, it's not in the media space, it's not only in the legal space, but as well as in the health space. There's a lot of sexual harassment and discrimination, and that is also another focus that we're looking at when we're trying to ensure that we have a conducive environment for women to thrive in the office and for them to achieve their career goals.
Right.
Yes.
And that's very important, because even when you talk about the workplaces, there's also the matter, we've talked about safe spaces. You might know that this is happening, but then do women feel safe to speak about this? Does Women Lift help in giving them some sort of empowerment or encouragement to feel safe enough to speak out?
Yeah, and precisely, and that is why our program, our leadership program is focusing on women, because they then create a safe space for them to discuss and look at projects that will influence even the institutions that they do come from. We are engaging the institutional leaders as well in this conversation. What are you doing in terms of ensuring that there's a safe space for women? And this includes policies as well. It's policy and practice. We can have all these sexual harassment policies, which we have done well. We have ticked. A lot of organizations do have it, but it is still happening. So there's a disconnect between the policy and practice is what we're trying to engage with leadership in these institutions.
What would it take to get it from policy to actual implementation? What would it take?
It's called the hard conversation. The hard conversations. It's bringing the leadership together, right? It's having the exemplary organizations also show other organizations how it is done. And because the argument is always the cost. It's always the cost. But what is the cost when you have a woman who's productive and is able to be in the office and, despite having children, can breastfeed and still deliver on her work? Can we not have a balance? We can certainly have a balance with your home role as well as your office role.
So for our viewers who are watching at home, if you manage to succeed in all your endeavors, what would Kenya look like? How does Kenya stand to benefit if we back all these policies that are women friendly?
What we will have is decision making that is balanced, because that is what we're looking at. We're looking at leadership parity, right? We want equal representation. We want the men on the table, we want the women on the table. We want male allies, we want female allies for both genders. So what I believe in is that everyone brings the value to the table. And right now I'm emphasizing on the women's leadership, the value they bring on board. If we can make sound decisions, we can make sound policies, and then we can implement the right policies. And we can have the health outcomes that we're hoping for, and healthy households
that we are hoping for. And thank you so much. That concludes our conversation. Anything you'd like to add before we wrap this up?
Yes, I'm just reaching out to the women in leadership or women in public health, because we have announced our leadership journey for 2023. The applications are on. We are covering East Africa, so that includes Kenya, Uganda, Rwanda, South Sudan, and Tanzania. So please reach out to the Women Lift Health portal, and you'll get all the information. And we have to reimagine leadership.
Absolutely. Thank you so much. That is Dr. Nora Obuthe, who is from Women Lift Kenya. Thank you.